What's going on, guys? So I wanted to talk to you guys today about something pretty sensitive but really important. We are getting older and we are at an age where we are going to have to deal with the death of our parents or our close friends' parents. Some of us have dealt with really loss from close friends or brothers and sisters. But same thing applies, but I specifically want to talk about the loss of a parent. Um, when someone's parent dies, they never give us protocol on what to do. As a friend or as the person who is dealing with the death. And some of us really do live in anxiety for a very long time because we're in and out of the hospital. You don't know if that particular time you're bringing your parent home or if that will be the last time that you see them alive. And that can lead to a lot of anxiety over time. When they pass, no one teaches us how to deal with it. And I'm 12 years in from my mother passing, and I want to tell you one of the best things I ever did, no matter how long time has gone by, was go to therapy. And I say this especially for guys because guys are more hesitant than females to go. No one has to know you're going. You can chat on your phone via text message back and forth on an app with a therapist or a grief counselor, because I've been asked what kind of therapist do I look for. Grief counselors are great. Psychiatrists, psychologists, whatever comes up under grief counselor. But no one has to know you're doing that for an hour, a week, to process through. I think a lot of times what happens with people as well is they feel that all the sorrow, hurt, pain, loneliness, all the emotions will bubble up, and if they let it out, it will never stop coming out. And that can be really hard. But I have to tell you, if you don't ever do that, you're never going to heal, right? And there's no real healing from it. I don't think that's a fair word to use, but those floodgates have to happen for you to start the process of living in your new normal. I won't say healing, say living in your new normal. But nobody has to know you're going to therapy. And when you get there, I think that's why a lot of people quit, because you all of a sudden somebody's making you digest and making you look in the mirror and making you talk about all the things nobody else, is discussing or has the professional training to discuss with you. Someone asked me, is there a big difference between talking to my friends and talking to a therapist? And I'm going to tell you, yes. The exact same thing, you're venting, but your therapist is trained with tools to help you process through. And I think that's the biggest thing. A lot of people don't stick with it long enough to process through, be it that issue specifically or be it other issues. I think every grown adult needs to go to therapy. But specifically for those of us who lost our parent, go. Plain and simple. Stop. You're so rageful. You're so angry. Everybody's getting on your nerves. You quit your job. You done. All of that is because you're trying to process emotions no one ever taught you how to process. And it's hard. And it doesn't get any easier. I really want to say his name, but I'm going to tell you a story. I was a waitress in Buckhead, Atlanta. Buckhead is really ritzy, just in case anybody else is watching this anywhere. And this actor came in. Really nice guy. He came in repeatedly. My mother had a crush on him growing up. And this is why I'm telling you, you don't get over it. So I run to the bathroom and I call my mom to tell her, your boo's here. Guess who I'm serving? And I just burst out in tears because my mother she had passed for 2 years. So it's really, really important for you all to understand things. You can feel like you're okay. You can feel like you're moving on and getting over it, but you may not have processed through it. I'm not saying you won't have those moments even if you do therapy, but I'm just giving you an example of 2 years later, still was something I had to deal with. 12 years later, still something I'm dealing with. And you learn to live with it, and you learn for it to be your new normal, but you don't necessarily get over it. Okay? And talking to people, venting to people that are not trained to help you process such a hard loss. If I didn't say it before, I'm going to say it again. For those people who have anxiety because you're going to the hospital repeatedly and you don't know if that's going to be the last time you see a parent alive, that's really, really hard. The other thing I want to talk about is if you are a friend to someone dealing with this, how to handle it. My arm getting tired. First of all, I would say I personally stopped telling people, "Oh, I'm so sorry for your loss." I don't want to hear that. I didn't want to hear it. I don't tell people that. This is going to be hard, and I'm here for you, are things that I've learned to say. What do you need from me right now? Okay, nothing? All right, I'm going to check in again. What do you need from me now? A good idea is a group text. If you know 4 of y'all are really cool and really tight, yo, bro, hey sis, this is our group text. When you need something, we all right here. We gonna figure it out. All of us gonna be on it for you, okay? I was very happy that, right place, right time. All 3 of my best friends were sitting right next to each other at the time, and they just passed the phone when I finally had a breakdown a year later. So the other thing is, be mindful that someone has to deal with a lot of paperwork, a lot of chaos, and they may not be able to just pick up the phone and tell you what happened, okay? They'll get to it. But they also are dealing with a lot of nosy people, right? Because people call, what happened? They want to be nosy versus being concerned. Concern is falling back and letting that person have the space and the breathing room to turn their mind on autopilot while they're digesting this death and still having to deal with a lot in a short period of time, okay? Because funerals come up quick, right? So they have to deal with nosy people, paperwork, planning, family members that ain't shit all of a sudden, everybody else's emotions, and they still have to process through all of that and stay strong enough to bury their parent. And then after that, there's more aftermath. So I would say that one of the best things that you can do is just say, what do you need from me? How can I help? What do you need me to do? Is it, you don't really need us to come to the funeral, but you're going to need some hands on deck to empty out the house? Is it, you want somebody to take the kids while you just kind of breathe? Do you need somebody to come over and cook dinner? And then the aftermath of that also is encourage your friends to go to therapy. Because I'm telling y'all, you can say you okay all you want. Okay, sure you are. But I think it's really important to give somebody some space. And even in that, I want to loop back to saying, and I say this all the time, 2 things, because I've done this video twice. I want to make sure that I'm hitting all my points. I'm not forgetting anything. 1, if you're like me, you don't have insurance, you can Google cheap therapists near me and call the office and ask them, do they have any students practicing? So even if you don't have insurance, I pay $25 a session. Best thing I ever did. Cheapest thing I ever did, and I could spend more on Amazon and Walmart, and my mind and my heart and my peace are way more important than bullshit that I buy. So I invested, and I would pay it for a month. I'm going to see you once a week at this time. I see you next week. 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 I could spend $100 on some therapy. No issue. The other thing I want to say is nobody has to know you're going. I say this to men especially because they're the ones who are usually like, I'm not doing therapy. Listen, first of all, more men that have gone need to tell more men they have gone. But you can text message a therapist now. They have apps where you could just chat. You can video chat a therapist. There's no reason why you can't go or shouldn't go, or no shame behind it, okay? Depression is a chemical imbalance in your mind as well. So for those people who feel like Jesus gonna fix it and Jesus ain't fixed it, you really want to hop on your mental health just as much as you do your physical. We all get physicals every year. Ladies, hopefully you getting your pap every year. You're checking on your vagina area. Men, you have to get your prostate checked eventually. You get your health scans and screenings every year. We get our eye exams. We do our dental exams. We do all these doctors, except for the ones who are trained to help us go through grief. Other thing I want to say is pre-record why you're going to therapy so you don't have to repeat yourself, and date your therapist, okay? Make like 3 appointments, see which one you like the most, play them that recording, see how they interact with you, and then pick one and then stick with it, okay? Stick with it, because the peace comes after the floodgates are open, and then you're in a nice calm ocean, okay? It's gonna be chaos at first because you are gonna bubble up with those emotions, but eventually, you'll have a nice beautiful ocean to relax in and be at peace in. And so There you go.